Hey guys, today we're going to discuss carpal tunnel syndrome. We're going to talk about the anatomy, the pathophysiology. We're also going to talk about the physiotherapy intervention and also the home exercise that you can do. So, what is carpal tunnel syndrome? It's basically a compression of the median nerve that occurs right in this area here. Common condition, it's a very common condition among office workers, manual laborers, and those with systemic conditions such as diabetes, rheumatoid arthritis, and pregnancy. And it's one of the most frequent peripheral nerve entrapments. As you can see, based on the anatomy of this area, this nerve really does not have much space. So you can see there's tendons and then there's bones around as well that don't give much space to the nerve. And when the nerve gets compressed, that compression causes irritation of the nerve, and then you get symptoms that are going to happen. As you can see here, this nerve most of the time innervates all of these areas right in here. So that's where your symptoms are going to mostly reside as well. So the median nerve compression is due to the narrowing of that tunnel. Now, why that tunnel gets narrowed, that's something that we'll discuss a little bit more in detail. Some of the causes can be tendon swelling, inflammation. So basically these tendons swell up and cause that nerve to compress because there's not really much space. Fluid retention, for example, in pregnancy, repetitive strain injuries. Some of the risk factors are poor wrist posture as well as systemic conditions such as rheumatoid arthritis, diabetes, and thyroid disease. These are things that make it more likely for these patients to experience these symptoms. Signs and symptoms. So something that you should watch out when you, if you do have carpal tunnel, you're going to have tingling in the thumb, index, and middle, and half of the ring finger potentially. This doesn't mean that it's always going to happen, all of them. It could just be the thumb, it can be the index or the middle finger. It varies depending on how severe the compression is. Pain is worse at night or with repetitive wrist use. You tend to have a weak grip, clumsiness, and potentially dropping objects if it gets severe enough. And then also in the severe cases, these muscles start to waste and wither away. So as physiotherapists, we use a few different tests to figure out whether that median nerve is irritated. So we can use a Phalen's test, which is wrist flexion. And if this provokes symptoms, meaning the numbness and tingling goes into here, or whatever symptoms you're experiencing and they get worse, this is a positive test. Same with Tinel's sign. This is the tapping on the median nerve and reproduces, this tapping reproduces tingling. And also Durkan's compression test. This one here where you're holding basically pressure on this area to see whether it reproduces symptoms. And these are some of the things that you can do at home as well to test and see whether you whether these tests are positive. When you go to the doctor, one of the main things they might send you for is nerve conduction studies. They also might do an ultrasound and MRI if needed. So in addition to looking at the carpal tunnel, that area, these are some of the other conditions that can give you the same symptoms, but it doesn't mean it's coming from the wrist. It can be coming from cervical radiculopathy, C6, C7, which is up here, or it can also be in the thoracic outlet area, right in this area. It can also be in the pronator teres area, which is right at the elbow where that nerve can also get compressed and pinched. So it doesn't mean it's only happening here. It could be happening here and giving you these symptoms down here. Diabetic peripheral neuropathy, this is in diabetic patients, and also arthritis or tendonitis at the wrist can also give you these symptoms. So this is why it's so important to get this actually assessed by a professional rather than just look at videos and try and figure it out yourself, because it could be up the chain, up the river. The occupations at highest risk for these types of injuries include office workers, postal workers, and cashiers. They're the ones that use the hands repetitively. Manual labor with vibration and repetition. Assembly line workers, mechanics, construction. We see this a lot in these industries. And then we also see it a lot as well as in nurses, because nurses, they're the ones that have to do things repetitively. Let's say if they have to do repetitive injections, different things like that, that can all bring on these symptoms. Dentists, same thing. They have to hold their tools for a long time. Same thing with hairdressers. Other high-risk groups that I've seen this in is musicians. I've seen this in gamers for sure, and then long-haul drivers as well. When it comes to management and treatment, these are some of the things that us as therapists, we can offer. We can look at getting you night splints. These are worn at night, and the reason why they're worn at night is because of the fact that these splints, they stabilize your hand and your wrist. Because let's say if you're sleeping and you're sleeping in that wrist flex position, well, that's going to irritate that nerve even more. So that's the whole point of the splint, is to stabilize everything. And then we would also ask you to modify your activities, especially the ones that are aggravating the symptoms, as well as look at the ergonomics and what we can do to change that. What you can expect from a therapist, at least at Pain Free Health, is because of the fact of all those other issues that could be happening, what we got to do is we got to look at the neck. And what we always do is work on the neck a little bit and see if any of those symptoms are reproduced when we try to work on certain areas of the neck. Shoulder and elbow complex as well. So we want to look at those as well to see whether something from the shoulder or something from the elbow could be triggering those symptoms further. And then as a modality, we could potentially use some dry needling to reduce the myofascial trigger points that could be happening, let's say in the forearm or even in the shoulder, in the neck area. Shockwave therapy to stimulate tissue healing in muscles and tendons. So let's say that tendon sheath over where that median nerve is irritated. What we might want to do is even potentially shockwave that area right there to see if we can reduce that irritation of the tendon sheath that's going over the nerve, and also at the forearm and different muscles that we might find that could be associated with these symptoms, as well as taping techniques. I find taping techniques quite effective, especially after a treatment where it could be irritated. Taping can be very, very effective, and this is something that you can do at home as well. Nerve and tendon glides and stretching for homework. So usually at first I focus on the stretching and not really the strengthening right away until we bring the symptoms down. Medical options is something that your doctor would be looking at. NSAIDs, corticosteroids injections. If physiotherapy doesn't work after a while, after about, let's say, 4 to 5 weeks of consistent therapy twice a week doesn't work, then what I tend to do is I tend to refer for potentially for some further imaging or steroid shots. And I've had some patients get a surgical release if all else fails. But a lot of the time, because of the fact that the true issue potentially is in here and they do a surgical release in this area, it doesn't mean that it's going to take the symptoms away, and they often tend to come back as well. So it's a surgery that does work, but sometimes I've seen it not work as well. And then obviously go home with some exercises, right? For example, like median nerve glides, wrist flexor stretches, which is what we're doing here, and then grip and pinch strengthening exercises. And then we would focus on gradual return to repetitive tasks with ergonomic adjustments. So prognosis and prevention. So early treatment is so important because of the fact that if this goes untreated, it may lead to permanent nerve damage. You can see on this patient here, on this hand, you can see the muscle mass is quite good. But on this side, because this is such a chronic issue, these muscles have literally withered away, because these nerves that are coming down here, they're the lifeblood. They're the life support of these muscles. And if these nerves are not firing, they're not doing their job, the muscles start to die. So that is why it's so important when you get that numbness and tingling to get that taken care of as soon as you possibly can. When it comes to prevention, and even myself, when I get patients coming in with these symptoms, I always look at their ergonomic workstations if they're sitting at a desk, because it is so important to try and modify that, because you spend a third of your life on your desk doing your work, and it's so important to try and modify that and optimize that, because that's where a lot of the time is the source of the issues. Adding breaks to your work, especially at the beginning while the inflammation is still going on and we're trying to bring it down, adding breaks, even taking some time off work if needed. For example, neutral wrist posture, you can see here, the positioning is very important, so that's something we educate patients, where the keyboard should be and where the hands should be as well. And then regular strengthening and mobility and stretching exercises. So summary take-home message, carpal tunnel syndrome is very, very common and it's treatable. As you can see, it's easily explained, and it's not a complicated thing. It's not a complicated thing, but a lot of the times it does happen as a result of repetitive use. The key is recognizing it early. Numbness, tingling, and night pain, that's when you want it taken care of. You don't want to wait till the muscles lose the muscle mass. Early physiotherapy ergonomic changes are key. Medical and surgical care may be needed if conservative care fails, and this is something that we're very good at, referring back to the doctor if things aren't working out. And patient education and prevention strategies to reduce the reoccurrence of this issue, because this is driven by repetitive use, so we want to try and optimize the motions and also try and add breaks and different things into your workday. Thank you for your time.